Medical rounds is an activity that is performed daily by medical or surgical teams to check on their patient's progress. Typically, rounds are performed with all members of the medical team. This includes medical students, interns, residents, fellows, and attending physicians. There may also be other members of the care team present, including pharmacists, social workers, or nurses. Each of these team members has a unique role. You should check with your senior residents to determine where morning round starts, what time they begin, and your role on the care team. Ideally, this is done before your rotation begins. If you're unable to contact your senior resident before your rotation, you should determine this as early in your rotation as possible, your role. In this YouTube video, we will discuss the typical role of a third-year medical student. Each morning when you arrive at the hospital, you will see patients that you've helped to admit or patients that have been assigned to you. You should expect to see these patients before team rounds. This is called pre-rounding. Your goal during pre-rounds is to uncover any patient-related events or new information that has become available since the team last met. Depending on your rotation site or setting, patient information may be located at the patient bedside chart, at the main paper chart located at the nursing station, or in the electronic medical record. To successfully pre-round, you may need to use information from all of these sources. For example, 24-hour fluid intake and 24-hour urine output data may be located in the patient bedside chart. Physiologic data, such as blood pressure, heart rate, and body temperature, may be located at the main paper chart. And consultant notes and laboratory test results may be located in the electronic medical record. Depending on the rotation site, it may take more time to pre-round if patient data is not located centrally. To ensure adequate pre-rounding time, be sure to ask your senior resident or intern where to find all of the information that you need to gauge how long it will take to gather that information. Each student eventually develops his or her own preference for the order in which to accomplish tasks during pre-rounds. However, the information that is typically acquired prior to seeing patients includes a review of each patient's prior progress notes, each patient's daily lab results, recent imaging results or studies, such as chest x-rays, CT scans, or MRIs, new consultant recommendations, each patient's most recent vital signs, EKGs that have been performed in the last 24 hours, and comparison studies from when the patient first arrived, and each patient's previous 24-hour inputs, fluid inputs, and outputs. That includes IV inputs, PO inputs, and urine outputs. And once you've obtained this information, you should go to your patient's room and perform a focused physical exam related to the patient's chief complaint or their comorbidities. More importantly, you need to talk to your patient and elicit any complaints that they may have had over the previous 24 hours, also using a focused review of systems related to the patient's chief complaint or their related medical conditions. By this time, you should be done pre-rounding and back at the team room ready to write your notes and begin team rounds. At this time, you should make note of whether any of the information that the team requested the day before has been executed or not. To do this, look in the preceding day's plan section of their daily progress note. This will allow the team to rectify any situations that come up during rounds. Teams may begin rounds from the workroom, but they may also choose to meet at certain other locations to start rounds. Again, check with your senior resident on your first day to see where your rounds will begin. While there are many things to consider on pre-rounds, each person develops their own system to keep all of this information organized. If you're having trouble organizing this information, or you're just starting out, you may be able to use one of the worksheets at a website to help you. That website is called medfools.com, and this is the URL to find those worksheets. Often, early in the third year, you'll be assigned 2 to 3 patients to see each morning. That means you'll need to gather all of the above information for each of your patients. As a third-year medical student, you typically report directly to the intern. That means if you have any further questions, you should ask them first. If the intern is unable to provide an adequate answer, go ahead and ask your senior resident. Additionally, the depth of information that is required from each patient varies based on the service that you're rotating on. For example, surgery primarily cares about patient lab results, signs of infection near surgical wounds, vital signs, and input and outputs. Medicine services typically care about that information, but also require a more in-depth pre-rounding exercise with emphasis on social factors and other aspects of patient care. I hope you found this YouTube informational video on pre-rounding useful. If you have any further questions, please leave them in the comments section below. Enjoy your third year.